issue with geriatric patients is that there are issues of decreased functionality. There may be issues with memory and cognition. There are issues of function and ability to take care of oneself. There are issues with geriatric patients tend to be on more medications, so complexity of medication programs. So each case has to be taken on its own accord, and we have to be mindful of the fact that when there are multiple medications, we have to be sure that there's no confusion as to how the medications are taken. If someone has to take a fraction of a tablet, we have to be mindful of the dexterity. Do we have to get the pharmacy involved in breaking down the tablets as opposed to relying on the patient for breaking down the tablets? We have to make sure the patient can open up their medication bottle. Do they need special bottles, or do we need to have a family member lay out the medications in a 7-day canister? We have to assess for memory. Are there issues with memory and being able to follow the treatment plan appropriately? Also, as we get older, our bodies are less forgiving to over or even underdosing. So we need to make sure that we're constantly reevaluating the appropriateness of our care plan. Yeah. Sure, so some of the challenges involving pediatric patients are the fact that our pediatric population are not fully developed. There are certain medications we just don't want to expose kids to. Now that we know about the heightened risk of opiate medications, we want to do our best to avoid the use of opiate medications and minimize the likelihood of any iatrogenic or treatment-related addiction issues. In addition, with kids, we have parents, so we need to make sure that the children and the parents have a good understanding of the program that we're prescribing.